This is The Rewind. I'm your host, Dan DeBruler, and in today's episode, we're talking with Steferia Nicholson, LaShonda Goff, and Angela Malloy about the reopening of the Cumberland County Health Department's Baby Store, which is an incentive-based program that nets our community healthy babies and healthy mothers. Thank you so much for joining us this morning. Going around the table here, we've got LaShonda Goff and Angela Malloy and Steferia Nicholson. Thank you so much for joining us today. Today we're talking about the grand, reopening really, of the health department's Baby Store, which opens tomorrow. How exciting.
Yes, it's super exciting.
We had the ribbon cutting on Friday, correct?
Yes.
And the store opens to the public tomorrow. Tell us a little about what the Baby Store is all about.
Awesome. So the Baby Store is back open tomorrow at 1235 Ramsey Street. So what it is, it's an incentive-based program to make sure our moms and babies stay healthy. So our mothers with children, or any family member that comes in with children, anybody that takes part of our health services, they will be rewarded with baby bucks, and then they can turn around and use those earned baby bucks to buy items in our store. Now,
the Baby Store itself is not truly a new thing. The first time around, it opened back in 2011, and then it's been opened and closed and opened and closed. Now we're back again. Is there something different this time, or is it funded differently this time around, or how's it back open?
Well, that's a really good question. Funding is something that we're hoping that will stay steady. We have been given some funds from our internal partners within the health department, and we're hoping that with our partnerships and some of our community partners like Mama's Village, Zeta Phi Beta Sorority Incorporated, who are acting as our community partners, March of Dimes, just to name a few, ICO for MCH of the Sand Hills Collaborative, are standing up to help us to support our initiatives to help reduce maternal and fetal deaths, and to give us some of the items to supply items within the Baby Store. And that's really important at this go-round.
Now, Steferia, I noticed you motioned to Angela as you were talking about Mama's Village, and that's the first time I have heard that phrase. What is Mama's Village?
So Mama's Village is a nonprofit organization that is in the community, and we support our families of color because, as we know, even though our maternal and infant mortality rates are high, in the Black community they are even higher. So we are set up to provide support, breastfeeding support, workshops, anything. And as Steferia mentioned about the collaboration, we are here in a supportive role to help fill in that gap when there's times that they need items for the Baby Store. We're hoping that we can use our networks in getting items and raising funds for the store. And we also provide breastfeeding education classes, which is a part of some of the ways that you'll hear later how they can earn baby bucks. We provide classes for the moms to help with those incentives.
You know, I think an incentive-based program like this is actually a really good idea because it does encourage healthy moms. It encourages a healthy care of children. And, you know, in a day like we're in, it seems like we need these things. And we're so glad that, you know, grants have been provided and that there's ongoing funding and that these can be possible. What's your takeaway? Are you a mother?
Yes, I'm a mother. I have a 2-year-old too. So, yes, I mean, it's amazing. I mean, we're encouraging these moms to get the health education and the health services, which is going to obviously lead to healthier babies and healthier moms. So this is just a kind of way to make sure everybody's happy, everybody's educated, and just lead for a healthier lifestyle for the entire community, really.
Do expectant mothers register, or do they register for these programs once they have a child, or how do they get involved with a program like this?
So it can start a few ways. It can either, and so I want to just say, LaShonda talked about moms, but we also encourage dads too, and even caregivers, because we know that this is a village type approach. If a mom comes in needing prenatal care services through the maternity clinic, they can start their services and earn baby bucks there. And then through health education, through our childbirth education classes, Angela's mentioned our partnership through breastfeeding care, and so is where can dad or caregiver step in. We offer smoking cessation classes because smoking is not usually one person, maybe a few people in family. So we offer those free classes in the health department so everybody can get on board with making sure that little one comes into the world smoke-free and with the support they need. That's a great way for everyone to jump in and start a healthy community.
So is there a one-stop place or one-stop shop for people to get involved? Do they register online? Do they come into the health department operates? Where do they get involved at?
So I would say they start with where they want to start their services. So you can start at maternity. You can start at WIC. You can start at CC4C. Ladies, jump in. Where else?
Yeah, and like
family planning as well.
Family planning, the smoke cessation class. So it's whatever service. If you find out, as she mentioned, the different services that are involved,
within
whatever
the health department
service you're utilizing, you would inquire about the baby bucks and find out how you can get more information. So like Stepharia said, it's kind of not like one place, a beginning spot. It's wherever you jump in. Now, of course, if the moms and families want to get the most out of it, you would want to start as early as prenatal services, and then you're able to take part in the childbirth education classes that they offer, and that's like your bang for your buck, because you can, with the 4 classes, you can get up to 100 baby bucks. So of course you would want to start as early as you can, but you can start anywhere within where you are with the services that they have.
So what are the qualifiers to get involved, first of all, with prenatal or infant care with the health department? Are there prerequisites? Is it based on your income level, anything like that, or is it based on need?
Let's just come on in, and we'll help you figure out where you fit in for the program, because smoking cessation is free. And so when you register for the class, you start earning your baby bucks. And the second pre-qualifier is that you have a child 0 to 5 years old. And so that's how you start earning baby bucks. Those are the 2 things: receive services through the health department, and that you have a child 0 to 5.
And I think to answer your question, because I was really surprised to find out, because a lot of you mentioned about qualifiers that would allow you for the services, and a lot of people assume that it's either if you don't have insurance. Mm-hmm. I was really surprised to find out that you can have private insurance and be seen at the health department as well. You can decide to have your prenatal services or your services for your children there. So as Stepharia said, whatever service that you're getting, just kind of inquire about it. But that was just one thing I would like to share with the public, because I just learned about this within the last 6 months, that they offer their services, and you can make that your care provider at the health department if you like. Mm-hmm.
So individuals become enrolled, you help them find exactly what is best for them, where they fit within the programs, mm-hmm. and then as they participate in these education sessions, they earn baby bucks. What happens with the baby bucks? Tell us a little bit about the baby store itself.
Basically, anything you can think of that would be at a baby store, we have there. Anything from onesies, diapers, wipes, baby bottles, anything you can think of. So once they start taking part of those services, they'll earn baby bucks, and those baby bucks range anywhere from about 15 to maybe up to 50 or even 100, like Angela said, they could earn for those services. And then they turn around, take those baby bucks, and depending on how much the items are in the store, they can use those and purchase them.
That's amazing. Now, where do the items come from? Is that what the grant funding is for, or does that come through private donors, or is there a combination of those?
It's a combination at this time, but for now, it's been the grant that's paid for it. And so we're hoping that we'll have some community champions stand in the gaps for us, because there's always going to be a need in our community. When you take on that precious little gift called a baby, there's shoes, diapers, wipes, and that it seems like they always need them.
That's right.
And they're expensive. So our baby store could, of course, utilize some community champions to help us take care of our community.
One thing that we're looking to do with Mama's Village, because we are a nonprofit, is we would like to begin where once or twice a year that we have an activity where we have donations from the community that will help to restock, and they're calling it a baby store. I keep wanting to call it a baby boutique, because it has also, along with the items that she mentioned, baby monitors, car seats. Mm-hmm. I mean, and the little outfits in there, it's like you're shopping in a baby boutique. Mm-hmm. It's really, really nice. And so we're looking to find ways that we can help, keep those items restocked, because it really is a nice place for our families to go and shop.
So is this a points only, no cash accepted kind of outlet?
Yes.
I'm going to go some classes.
I know, it's really nice.
It's really nice.
It really is.
How are you communicating your need for ongoing support, from the private sector? Is there some way that you are communicating that need now to potential donors or sponsors of this program?
Well, right now, We've allowed our senior leadership at the health department to funnel that community champions to contact them by calling 910-433-3700 and speaking directly to our financial officer, Ms. Candy York, and then letting her take the financial donations and then bringing any brand new items directly to the health education division. And then we'll make sure they get stocked to the store. But again, they need to start with Ms. Candy York. And then we'll be happy to make sure that persons get credit for those. But we don't, because we're not a nonprofit, we just have to be very careful for that.
Now, Angela, one of the things you mentioned a moment ago was perhaps in the future there would be some donation-type events where people can bring things in through.
Mama's Village, Fayetteville.
That's where it would come in?
Correct.
Okay. And how do they connect with Mama's Village?
And then there's also, we have the Fayetteville Breastfeeding Center, which is a community lactation clinic that is on downtown on Hay Street. So you could do both organizations. And like Safiria said, we're going to find out the specifics on how we can put this together. Like, we're going to put a donation thing. We'll get with Miss York and find out the proper way of, if we have those cash donations or if people bring brand new items. And we're looking to hopefully do that within the next couple of months, because August is National Breastfeeding Month, World Breastfeeding Week. Mm-hmm. It's like the Super Bowl of breastfeeding in August.
Yes.
And so we figured that, and that's the time when people are looking to support families. And so we're looking to maybe hold something during that time as well. So we're excited about just taking our resources and being able to support families in another way, which is through the baby store.
And since you are a nonprofit, we would be able to interact with you in a different way, where
wonderful.
we could bring things
right.
Yes,
that could perhaps benefit indirectly
that is
the baby store, things that you can't do because you are a public entity.
That's correct.
That's awesome.
That is correct. Yeah.
It's awesome that we're hearing that.
Yes.
And Mama's Village Fayetteville does have a partnership with the health department through the ICO for MCH grant, so it may make it easier because we already have a standing kind of memorandum in place that we can provide that and make it easier for people to donate to this program.
Well, we definitely look forward to hearing more about how this all can come together as it continues.
Yes.
I mean, that's exciting for us as a community. Is this something that's going on around the country, or is this a kind of a pilot program?
So it's funny that you mentioned that, because when I shared the pictures and everything from the event on Friday, and because I'm connected with a lot of professionals in the birth community and in the lactation community across the country, I started getting messages from people in different cities and states saying, oh, this would be wonderful if we could do this at our health department. So apparently it's not at everyone, all the health departments, but I'm thinking that as we share it more, and because we're connected with people that are in different cities and counties and different states, that will give them ways to approach their health department and say, hey, this is how they're doing it down in Cumberland County. Can we figure out a way to contact them, see how they got it started, where we can bring it to our health department? So this is also a win for the community at large around the country.
That's great. I've heard so many things in the last several months where Cumberland County is truly breaking some ground in a lot of different areas, and it's exciting to hear that this, too, may be leading the way for better health for mothers and babies all around the country just because of your efforts. So thank you very much for all that you're doing. Is there anything that we left out that we just need to say before we get out of here?
Come down to the health department, 1235 Ramsey.
And the baby store will be located where?
On the second floor.
Oh, it's in the same building?
Second floor.
That's awesome. Well, thank you very much for joining us. Again, we've been talking with LaShonda Goff, Angela Malloy, and Steferia Nicholson. Thank you so much for being with us.
Thank you.
You've been listening to The Rewind, produced in the Fayetteville, North Carolina studios of WCLN 105.7 FM. To learn more, visit Christian1057.com or click subscribe now and never miss a thing. Until next time, I'm Dan DeBruler, and this is The Rewind.